Hello, I'm Dr. Hadija Tukan, internal medicine and palliative care physician at Massachusetts General Hospital and Harvard Medical School here in Boston, Massachusetts, USA. On behalf of my co-authors, it is my distinct honor to share with you a brief overview of the recent work we did to estimate and design a response to the palliative care needs of women with cervical cancer. As the fourth most common cancer affecting women globally, cervical cancer presents with complex and severe suffering that is often invisible. Recently, the World Health Organization announced its strategy to accelerate the elimination of cervical cancer as a public health problem. The third tier of this strategy involves proper management of women diagnosed with cervical cancer. We believe that an essential part of this management is the provision of palliative care intended to relieve the suffering associated with cervical cancer. Our first step then was to quantify the amount of suffering associated with cervical cancer, then estimate the palliative care needed to respond to this suffering. Spearheaded and sponsored by the World Health Organization, we then designed the first global study aimed at estimating the suffering due to cervical cancer. We first started with a literature review to identify the major types, severity, prevalence, and duration of suffering due to cervical cancer in 2017. This data was further refined by conducting a Delphi process with cervical cancer experts across all continents and income level groups. In order to estimate the respective palliative care needs for this suffering, we applied the suffering prevalence and duration estimates to the number of decedents, meaning those who died from cervical cancer, non-decedents, those who had cervical cancer but did not die, and family caregivers in 2017. We further used recommendations from the World Health Organization to then design an essential package of palliative care, which I will talk about in just a second. Before that, I'd like to, however, share with you briefly our findings as it relates to suffering associated with cervical cancer. We found that most patients and family caregivers experience a combination of physical, psychological, social, and spiritual suffering. There were various forms of this suffering. Physical suffering, for example, took on the form of moderate to severe pain, debilitating vaginal discharge, and bleeding, amongst other things. Psychosocial and spiritual suffering came in various forms, some of the most prevalent being anxiety and depression, sexual dysfunction, financial destitution, abandonment by intimate partner, and social stigmatization and discrimination. The second step was then to design an essential package of palliative care in order to respond to the suffering of women with cervical cancer. In 2014, the World Health Assembly declared palliative care an ethical responsibility of health systems and stressed the importance of integrating palliative care into primary care, including home care. It's also important to remember that as an essential component of comprehensive cancer care, palliative care can be integrated at any point across the continuum of care. There's no dichotomy between palliative care and cancer-directed care, even if the latter is for curative intent. Studies actually show that early integration of palliative care can lead to improved adherence to treatment as well as improved outcomes. Using a previous guide from the World Health Organization on how to integrate palliative care into primary health care, we designed an essential palliative care package for women with cervical cancer as well as their caregivers. The essential package of palliative care for cervical cancer was purposefully designed to be safe and feasible in even the most resource-limited settings. It consists of various interventions, medicines, equipment, social supports, and specifically trained human resources, and all for the purpose of preventing and relieving the various types of suffering we identified in our study. In the interest of time, I will let you consult at your leisure the 4 following slides detailing the content of the essential palliative care package for cervical cancer. In closing, we found a high prevalence of severe and complex suffering among women with cervical cancer. We believe that an essential package can prevent this often neglected suffering. Here is a list of all of the authors of this paper, and for further reference, please go to our full publications from June 2021.